belt on, you've set the resident. Of course, you get the resident out of the bed first, sit the resident at the end of the bed, and then you put the belt on from the front, not from the back. So then you make sure this patient has something on their feet before you transfer them to the chair or whatever. Yes. So make sure that the wheelchair is locked. The patient is sitting right here, and this is the wheelchair. So you put it like this, and then you lock it. When you lock it, now you count with the patient. So you tell the patient to count for him or herself. 1, 2, 3. If the patient cannot stand by himself or herself, then you will let a second person to help you. But don't lift somebody. You don't lift. We don't do lifting. Okay. Oh, this person is so light, I can just lift him. No, we don't do lifting. Yeah. And then make sure you have to tell your nurse immediately so that they can change their care. From maybe from a 1 assisted to 2 assisted. So which means this patient is no longer going to be able to stand. This patient is going to be using a machine most of the time. The first thing you walk into a patient's room, knock. Introduce yourself, say what you're going to do there. Then after you introduce yourself, excuse yourself and go wash your hands. Say, I'm going to wash my hands. I'm going to wash my hands for 20 seconds. You're not going to tell the patient you are washing your hands for 20 seconds. But now you're doing exams. You tell him, yeah. So you say, knock, knock, and so and so. I'm here to take care of you. I'm going to transfer you from the bed to the wheelchair. First of all, I'm going to wash my hands. So wash your hands. When you're done washing your hands, and provide privacy all the time. You just pretend like, oh, I have to provide privacy. You draw the curtains around, and then you start giving the care to the patient. That's the second one. You have to make sure that the person has something on the feet. And then use a gate belt all the time. You don't just use your bare hands grabbing rescue patients. We don't use muscles. Yeah. If the person cannot transfer or cannot bear weight, that's a different care plan again for that person. Yeah. So don't struggle yourself. Don't kill yourself like, oh, I have patients. I have to get them up. I have to do this, and then you go ahead and then throwing them in the wheelchair or whatever. No, we don't do that. First is illegal, second is the bank. You can't do that job for even a month. You're gonna break your back. We have catheters. You guys have seen catheters, right? Mm-hmm. Yeah, you know how to empty them. It's a simple thing. Anytime you want to empty, maybe that's the only thing you want to do in that room. That's another skill they give you. All the time, knock, introduce yourself, wash your hands, provide privacy, and then do whatever you want to do in that room. So the 3 things you have to be seen. It's like a nursery, whatever you have to be seen in. Knock, introduce yourself, wash your hands, and provide privacy. Because rooms are shared rooms, so you can't just. The curtains open like this. This is a bed. This is a bed. I'll come here and then can I change you over here and somebody is just watching you. Even if you're old, even if you're not talking. At least there's that thing. You feel like this person doesn't respect me. So we are being taught to be mindful to each other, like everybody, whatever you want to be, that is supposed to be done to you. Do it to somebody else too. You have to show privacy for everybody. Yes, and respect. That's it. So you empty the catheter. That's a bag that has a lid down here. we just screw it like unaifungua tu kidogo. Don't open all the way. You just open kidogo, then it will just drain. We have graduates that measure. So let's say this person for fluid restrictions anafaa kwa monitor the intake na output. So lazima nasa anakwambia when you go to so-and-so's catheter bags, please let me know how much was it. So the bag imeandikwa.
Oh, it has measurements.
Yes.
Yeah. Okay.
So or it's just you can help them to that graduate, and then you use the graduate to measure it, or you can just look at the bag. Yeah. But use the manual preparation. You know we have the quick one, but we have the manual one. So that's the one we use actually when we're doing tests. Those are the ones they use. They don't use the ones nowadays. In exams, no. Yeah. In exams, because we have, they're preparing for anything. They don't know where you're gonna work. They don't know where you wanna work, where you're gonna work to start working. Tunapanga na typical those old grammars. They have never used the digital ones. They believe those are not correct.
Okay.
They believe the manual one is the one that will give you the correct readings. So you see, that's why they prefer the manual ones. They are harder to know. So that's why they prefer for you to use the manual ones when you're doing your test outs. But when you are done with your test out, you now are free, you have the certificate and you start working. We don't use those manuals unless we have those patients who will tell you, no, I don't want to use that preparation machine. I want to use the manual. Unless. But in your test out, you're going to use that manual preparation machine. And you have to count the half. Yes. All this. So that's another skill you do. Oh, they will tell you to do Pericare for a female. That's very Pericare is just what giving Pericare, like changing briefs for a female patient. So we actually have 4 towels, 2. The small and the washing, the 2, like all the towels, like maybe if you have 3, it's okay. But 3 sizes, those are 3 in sizes, not 3 towels. So 3 in sizes, which means you have 6 towels. So you have the hand wash, the wash grips, the doko, 2. You have hand washing one, the bigger sized, and you have the bath towel, 2 of them. So when you're doing Pericare, make sure you put the big towel underneath. Yes. And then when we do wipe, how do you guys wipe a person from where to where? Back to front. No, we don't do back front. We do front to back. Yes. If you do from back to front, you're giving the person immediately a UTI. And the person can get infections. And you don't want that. Yeah, so it's a front to back job. Yeah. Then now, because you're giving Pericare, you're going to the sink to turn the water on. So if water that is okay with me is not okay with you, so after you bring that water with the basin or the bucket, you tell the patient to test the water first. It's the person you're giving care to give you an okay to proceed with the cares you're doing. So if the patient says it's okay, the water temperatures are okay, then you are okay to proceed. So first of all, you have your 6 towels. One is to wash, and one is to rinse, and the rest are for dry. We're done with that. And remember, when you're done, you changing this person. You roll this. You changing. After you cannot give pericare for this person with the same gloves. You're done with washing up and everything, and then now you bring another clean brief. You're putting on this patient with the same gloves. You change the gloves, and now you changing the gloves. You have to say, I'm gonna wash my hands again. So basically, it's washing hands. We have another skill of side laying patients. Those patients who are bedridden. So you reposition. We call them repositioning. So when you reposition this patient, you have to have like 4 pillows for this patient, because you want to have 1 pillow inside here in between the legs, and then you have to have another pillow maybe under the other leg, and then you have to have another pillow supporting the back, and then you have to have another pillow on the head. Then you raise the legs a little bit high, up a little bit, and then the head according to the height, and then make sure the bed is all the way down. Before you leave the resident's room, you have call lights. You give the resident the call lights and ask the resident, is there anything else I can do for you before I go? Then you can, okay, walk. Check all the, so when, let's say somebody was messed up, somebody pooped on themselves. When you're changing this person, you are done everything. You don't like, oh, I cannot touch those beds with my bare hands. You will touch them with your hands, with your bare hands. The trash bag that has poop inside, you don't walk with gloves outside the hallways to the soil around. You're done with all your cares. Now you live in this patient's room, right? You take your gloves off, you wash your hands, then you cut your trash outside the room. Yes, it's a normal thing, because those are human beings. They are like you. Nobody knew that he or she's gonna end up the way. Yeah. So take it like if it was me. What if this person that I'm taking care of was me? What could I expect from this person to do for me? What can't I do it?